When doctors and nurses were panicking in the emergency room, the maintenance worker calmly rushed to the injured patient's side. He dropped his cleaning cloths and began applying perfect first aid. His movements were so professional that the chief physician asked in amazement, "Are you medical personnel?" The maintenance worker replied, "No, but I've seen a lot of blood. Welcome to the human stories." Before we begin this shocking story, tell us in the comments which city you're watching from today, and if you believe stories like this need to be heard, hit that subscribe button. Because the truth you're about to learn will astound you. David Thompson, 48 years old, worked as a maintenance worker at City General Hospital. He had been doing this job for the past 6 years and tried not to draw anyone's attention. He was calm, reliable, and obedient. His shift started at 6 a.m. and ended at 2 p.m., but if anyone had noticed David's work style, they might have seen a few strange details. The first strange detail, David's cleaning route. While other maintenance workers cleaned rooms randomly, David always followed a specific system. First the emergency room, then operating theater corridors, and finally patient rooms. As if he knew medical priority order, the second detail, David's behavioral change when seeing blood. David, who was calm during normal cleaning work, would suddenly become more careful and faster when he saw blood, serum, or medical waste, as if he was very familiar with such situations. The third and most notable detail, David's hands. They were very firm and steady for a 48-year-old maintenance worker. And sometimes, when emergency announcements were heard, some people noticed his hands trembling slightly. Dr. Sarah Mitchell, emergency department chief, always wondered about David. Why is this man so calm? She would ask herself. Because even during the most stressful moments in hospitals, David never panicked, but no one knew who David really was. Until that day's crisis moment, and today, everyone would learn. That Wednesday afternoon, the emergency room was calmer than usual. David was cleaning the second-floor corridors. Cleaning cloth in hand, cleaning cart on the floor. Just then, an ambulance siren approached. Fast, very fast. David froze. That siren sound. Ambulances coming with that kind of urgency usually meant serious cases. A few minutes later, the emergency room doors opened and paramedics rushed a man in on a stretcher. 45-year-old male patient, work accident. Open fracture in left arm, heavy blood loss, pulse dropping. Dr. Mitchell and the nursing team immediately took action. But the patient had lost so much blood that the situation was very critical. David was watching the situation from the corridor, and he noticed that something was going wrong. Nurse Jenny was trying to set up for fluids in a panic, but her hands were shaking. Dr. Mitchell was trying to treat the wound, but the blood loss was too much. And the resident doctor, Dr. Park, was inexperienced with this type of trauma case. The patient was unconscious and his pulse was steadily dropping. "More fluids, fast!" shouted Dr. Mitchell, but Nurse Jenny couldn't properly set up the 4-line under stress. Precious seconds were passing. David couldn't stand it anymore. He left his cleaning cart and walked toward the emergency treatment room. "Excuse me, Dr. Mitchell," he said in a calm voice. "Can I help?" Dr. Mitchell looked at him in amazement. "David, this isn't the time. Please go outside." But David moved. He went to Jenny's side and said, "Allow me." And then, in front of everyone, he placed a perfect cannula. In one move, flawlessly. Dr. Mitchell froze. How did you do that?" Instead of answering, David looked at the patient's wound. In this type of trauma, bleeding control is essential first. Applying pressure isn't enough, you need to find the exact point of the artery and close it, and he put his hands on the patient's injured arm. He found pulse points with his fingertips and applied pressure exactly to the right spot. The bleeding immediately slowed. "How do you know this?" asked Dr. Mitchell. David continued working silently. "Increase the fluid rate, and prepare adrenaline." Pulse dropped to 55. Dr. Park asked in amazement, "Did you study medicine?" "No," said David, "but I've seen a lot of blood." 15 minutes later, the patient was stable. He was taken to the operating room and was out of life danger. When the emergency treatment room quieted down, Dr. Mitchell turned to David. "David, who are you?" David took a deep breath. "Dr. Mitchell, I'm just a maintenance worker." "No. Maintenance workers don't act like this. You have medical knowledge." Where did you learn these things? David stopped. He had never wanted to talk about it, but it could no longer be hidden. I was an army medic, he said quietly. Dr. Mitchell's eyes widened. How many years? 12 years. What operations were you in? A heavy expression appeared on David's face. Iraq, Afghanistan, Tutur. Nurse Jenny was still in shock. Were you really a military medic? Combat medic, said David. 6-8 months, 12 years active duty. Dr. Mitchell sat down. And now you're doing maintenance work here. Yes. Why? I mean, with your medical experience. Double quotes. David quietly replied. Dr. Mitchell, some stories aren't told. They're just lived and tried to be forgotten. But why did you hide it? Why don't you work here as a medic? David paused, thought. Because I left that life behind. But today. Today my old reflexes kicked in. Dr. Park asked curiously. What did you experience in war that you can act like this? We experienced a lot in 12 years. But what I remember most was what happened in 2007, in Ramadi. What happened? David took a deep breath. Bombing attack. Mortar attack on forward operating base. 23 wounded soldiers. I was the only medic at that moment. For 6 hours, non-stop. I had to save them all. Did you save them all? I saved 21. I lost 2. There was silence. Dr. Mitchell knew what these numbers meant. Saving 21 lives was difficult work even under normal hospital conditions. Under war conditions, it was nearly impossible. So why did you leave the army? Asked Dr. Mitchell. PTSD, David said briefly. And physical injuries. I still have shrapnel pieces in my left shoulder. In 2009, on my last mission, what happened? IED explosion. Me and 4 soldiers were wounded. While treating the other 3, I didn't even notice my own injury. I only passed out after they were all safe. Jenny listened quietly. And then, 18 months in hospital. Physical therapy, psychological support. And then, return to civilian life. But why did you come here as a maintenance worker? David smiled. Because being in hospitals makes me peaceful. Being in a medical environment reminds me of old times. But this time no one is dying. No one is suffering. Do you ever regret it? Not being able to use all your experience? No. I serve in a different way here. I used to serve wounded soldiers. Now I help medical staff in a clean environment, Dr. Mitchell thought. David, you could transfer here as a medic. Your experience is very valuable. Thank you, Dr. Mitchell, but I'm happy with my maintenance job. If I can help in situations like today, that's enough. The next day, the hospital director called David to his office. He had read the report Dr. Mitchell wrote. David, said the director, what you did yesterday. That patient could have died. I know, sir. Why did you never mention your background? Because the past isn't something to brag about. Here, I'm David, not Sergeant Thompson, the director thought. Can we get consultation from you in emergency situations? Of course, but only when necessary. In the following days, hospital staff began looking at David differently. But David didn't change. He still worked with the same calm, the same humility. A week later, in the emergency room, a young intern, Dr. Lisa Chen, was struggling with a difficult case. An elderly woman had suffered a heart attack and her pulse was dropping. Dr. Chen was in panic. She was in her first year and had no experience with such critical cases. David saw the situation while cleaning in the corridor. He approached Dr. Chen. Dr. Chen, stay calm. First take a breath. David, I can't do it. I might lose the patient. No, you won't lose her. Now listen to me. First check the EKG, then adjust the adrenaline dose. And most importantly, trust yourself. Dr. Chen listened to David's calm voice. She took a deep breath and applied what David said. 15 minutes later, the patient was in stable condition. Thank you, David. If you hadn't been there. Double quotes Dr. Chen, you already knew what to do. You just needed a little courage. That night, Dr. Chen was thinking at home. David wasn't just a maintenance worker, he was a teacher, a guide, and perhaps the most experienced person in the hospital. David Thompson was an ordinary maintenance worker at City General Hospital, until that emergency moment. Then everyone learned that sometimes the most ordinary-looking people can have the most extraordinary pasts. But David's real greatness was carrying his experience with humility. He just continued to serve. First wounded soldiers on the battlefield, now medical staff in the hospital. Real heroes don't brag, they're just there when needed. A man who saved 21 lives in 12 years was now continuing to save lives in a different way. Quietly, humbly. Have you ever met someone like this? Someone who seemed ordinary but had an extraordinary past. Share their stories in the comments and tell us which city you're watching from. If this story touched you, subscribe and help ensure stories like this are heard. Because sometimes the strongest people are the quietest ones. Until we meet in the next story. And remember, next time you see someone ordinary working in a hospital, nursing home, or any healthcare facility, maybe their story runs much deeper than you think.